Hi, my name is Margaret Kennedy. I'm a registered nurse at Lancaster General Health Penn Medicine, and I'm going to teach you today how to discontinue an IV catheter from your patient. When I was preparing for this speech, I had memories back to grade school when I had my very first speech in front of a class, and it was also a demonstration or teaching speech, and I taught my class the proper placement of the fork and knife at the dinner table. So I did, there's a little quick way to remember to make it easy. Fork is F-O-R-K, 4 letters, and left is L-E-F-T, 4 letters. And then knife is K-N-I-F-E and R-I-G-H-T, so that tells you that the fork goes on the left and the knife goes on the right. But I've moved on from grade school and now being a nurse. Today I'm going to first introduce you to the purposes and uses for the intravenous catheters, or IVs as we call them, some myths about them, and then conclude by teaching you the actual steps to discontinue the IV from your patient. Almost all patients at the hospital are placed on, every patient that's admitted has an IV catheter, and they're used for many different purposes. The first one could be for intravenous fluids, for patients that are dehydrated. You can also give IV medications such as pain medicines and antibiotics through that. You can administer blood and blood products through the intravenous catheter. And they're also used to administer contrast dyes for certain diagnostic tests. There are some myths regarding intravenous catheters. One being that people say, oh, I have a needle in my arm. Well, it's not really true that you still have a needle in your arm. When you put this in, we actually do use a needle to put it in, but then you pull the needle out. So what you're actually left with is this flexible catheter that remains in the vein. So it's not actually a needle staying in the skin. And also people think that they're going to have a hole in their skin all the time, and that's not true. It heals back up. You're not going to leak fluid or anything. So on to the removal of the catheter. You can refer, of course, to your Lancaster General Health has hospital policies and procedures. There's one for that, for all about the intravenous therapy. First thing you want to do is perform hand hygiene. When you come into the patient's room, you're going to perform hand hygiene, wash your hands, gather your supplies. You'll need some alcohol swabs, some gauze dressings, some tape, some gloves, and your patient. So you can explain the procedure to the patient. You should have the patient in a sitting or recumbent position. I have a little visual aid here. This patient already has his IV in. So you're going to have them, a sitting position, like I said. You're going to put your gloves on and you're going to explain the procedure to the patient. So, ma'am, I'm going to be taking your catheter out. It might pull a little bit with the tape, but then we'll get that out so you can go. Explain the procedure, put your gloves on, and then you're going to remove this dressing. So when we were first instructed on these dressings, we were told that it helps to use alcohol to keep it from sticking to the patient's skin. So you can use alcohol to get the dressing off from the patient. It helps it from not adhering so much. So you want to anchor your catheter there as you pull off the dressing, so you don't make a bigger hole or bigger bleeding problem with it. You can inspect the site to make sure there isn't some signs of infection or anything. And then you're going to get your gauze dressing, place that on top. And with one smooth move in your dominant hand, you're going to pull gently and place pressure at the same time to discontinue the catheter. When you're finished discontinuing it, you just inspect the catheter site to make sure it's intact and that you got all parts of the catheter. That's sticking to my hand. Thanks. You're going to hold pressure till hemostasis is obtained, and then you can use your tape to make the dressing, or you could actually just use a Band-Aid. You're going to place this on the patient, and there you go. It's discontinued. Okay, thank you. You've now been introduced to the steps involved in discontinuing the catheter. In the hospital setting, nurses and patient care assistants are able to perform this task when their competency is determined. Also, hands-on practice of course, hands-on is better to really get the skill down. For the patient, this is the last step that they do before being discharged to home, so they're always happy with whoever comes in and completes this task for them. And that is the end.